Okay, my name is Adam Rouse, and I'm going to give an informative speech on basic first aid. This speech is to inform people about basic first aid that may or may know what to do in those situations. Any help given in an emergency situation can help survival rates. Imagine you're eating at a dinner table with your husband or your wife or your kid, and they fall out on the floor. And did they have a heart attack? Did they have a stroke? Maybe it's some new onset seizure. Maybe they hit their head earlier in the day. Maybe they hit their head when they fell. Okay, you call 911, but what do you do till they get there? That's what this is to help you with. Being prepared for basic first aid and what to do in an emergency situation can help and does help save lives. No matter if you're ready for it or not, emergencies happen. It doesn't matter where you are or where you live, it can happen. I'm a combat lifesaver in the Marines with 2 tours to Iraq. I got out of the Marines and went and done my EMT. I got my advanced EMT. Became an RN. I've been an emergency room RN with a certification in emergency room nursing. So first aid requires knowledge and practice. A person that has had no training may freeze up or not know what to do, or even worse, do the wrong thing. Best practice is to always be prepared to help other people. Always call 911 when you're unsure. So for basic CPR, you want to use the CAB method, or CAB, circulation, airway, breathing. Circulation, you want to check a pulse. You always go to the side of the neck, nearest you. You want to lightly press with 2 fingers, and you can feel the pulse. If you don't feel a pulse, their heart's not beating, they probably need CPR. Once you do that, you want to check their breathing. Do you see a chest rise and fall? You can also get really close to them, and you can hear their breathing, feel their breathing. Once you decide they don't have a pulse, they're not breathing, you want to start CPR. You want to place the heel of your hand in the middle of their chest. You want to compress about 1/3 of their chest, usually about 2 or 3 inches for adults, and at a rate of 100 to 120 beats per minute. Most of the time, we hear about giving breaths with it too. You want to give 2 breaths to every 30 compressions. New CPR says that if you don't know how to do the breaths, you just keep doing compressions. But with the breaths, you want to tilt their head back, open their mouth up a little bit, squeeze their nose, and make sure you make a seal between your mouth and theirs. The breath should be no longer than about 1 second long. Watch their chest rise and then fall. Give 2 breaths, 30 compressions. After CPR, you might want to check for bleeding. That's part of that CAB also, the circulation part. So if they're bleeding out, if it's a normal scratch, everybody's used to them. You got Band-Aids for that. If it's a nosebleed, you don't want to hold your head back and let it run down your throat or introduce any of those bacteria to that cut. You want to hang your head forward, pinch across the bridge of the nose. If it's more major bleeding, like arterial bleeding, pressure is always the thing. You put as much pressure as you can on it, it should stop the bleeding. If not, you want to elevate it above the level of the heart, maintaining pressure. Sometimes pressure, and that doesn't work. Pressure should work 95% of the time. When that doesn't work, you can do a makeshift tourniquet out of anything. So say her lower arm here has arterial bleed in it. You've tried pressure, you've tried elevation, you've done everything you can, and you can't get it to stop. You want to tie something, not super tight, leave a little room, get something hard, and you can twist it over and over until it cuts off all circulation. You use whatever you're tying it with to hold it in place. That will make a makeshift tourniquet and stop the bleeding until help will arrive. Once the bleeding, we're going to have her sit up here. Say bleeding isn't the issue. So, say the issue was she fell, broke her arm, or it's dislocated. Spin around for me. So it was dislocated. It might be hurting to put any pressure on it. She can't help not hold it or not move it around. So say it's broke up in her upper arm. You can make a makeshift sling and swath is what it's called. The sling, you're just gonna wrap something around her, tie it up a little bit, and put her arm in it. And that's just to make sure her arm's not dangling, and it kind of keeps it in place. But if you got a ride to the hospital or wherever you go, it can still move at the elbow. So this is called a swath. You can wrap it around, and it helps hold her elbow to her body. You tie it in there, keeps the elbow down. Sling and swath. If she were to be choking, normally they would be standing for this situation. You want to find the end of the sternum. Kind of hold your thumb in your fist. Place 2 finger breaths below that into the stomach and push toward you and up very forcefully over and over to help dislodge that. That's a quick Heimlich maneuver. In older people, your parents or somebody you may know, can have strokes. So for strokes, you want to look for FAST is the acronym this will be able to use. Face, arms, speech, and time. Time is a necessity. Once again, always call 911. But what might set you off for this is one of those other things being wrong. So the face, you might see facial drooping on one side. Arms, if they hold them up, one of them might fall. They can't hold both arms up. And speech, their words might come out gurgled up, not sounding right. They might slur their speech. So those things are things to be aware of for strokes in those situations. If it's a seizure, you don't want to hold a person in place for a seizure. They're going to be laying down, shaking everywhere. What you do want to do is get them on their side and protect their airway. When they're on their back, they can't swallow when they're having a seizure, so they can actually aspirate some of that. So if they're on their side, that comes out. Also, you want to put a pillow or something underneath their head because you want to protect that head from hitting the ground. After those two, that's kind of comes to the end of quick, basic first aid there. You should be prepared for any situation. Friends, family, they all may need help. Maybe it's a random person on the street, no one else knows what to do, but you do. If you're a parent, you always need to have CPR certification. You never know when something may happen to your child. So that's always a good idea. If it's never needed, that's fantastic, but at least you have the training for that peace of mind. If you're ever in that crazy, scary, heart-pounding situation, you'll be so thankful that you knew what to do. So thankful that you could save that person. It may have been a loved one to you or a loved one to someone else or a friend to someone else. Thankful that you knew what to do for your child when they had that cut, when they needed stitches, when they needed to go to the hospital. You knew when to call 911. Eventually, everyone will face an emergency. Once you learn the basics, the first aid, you can add that to help with more serious situations. Stay calm and remember, slow is smooth and smooth is fast.